Hello, so I'm talking to you from outside in the cold because today's topic is about Raynaud's disease. It's when some areas of your body, such as your toes and fingers, can feel numb and get cold in response to the cold temperatures or even due to stress, okay? Raynaud's disease is when the smaller blood vessels constrict, okay? And that limits blood flow to the areas, okay? Women are more likely to get it than men. It usually happens in the colder temperatures, okay, colder climates. And in addition to just cold toes, you also will get color changes, okay? When it's first affecting your toes, they will turn white, okay? And then as it continues, they'll get blue and feel really cold and even numbness at that time. And then as your toes warm up, okay, and your circulation improves, okay, they will turn red, maybe throb, tingle, pins and needles, stuff like that. Okay, and although it most commonly affects the toes and fingers, it can also affect other areas like your nose, lips, and ears. Okay, after you warm up, it takes about 15 minutes for the part to return to normal. So, what causes Raynaud's syndrome? Okay, and it's like I said before, it is a spasm of the arteries in the toes, and the arteries become narrowed, and it limits blood flow to the areas. Okay, stress can also cause this too. So if you're having stress or anxiety, that can cause the blood vessels to spasm. And it's not necessarily just being outside in the cold. It can happen in warmer climates when you have the air conditioner on, too. But usually, like if you put your hands underneath cold water, it definitely happen. Or you're taking things out of the freezer, it'll happen. Those will trigger it, or severe like emotional stress episode can trigger it. There's two main types. Primary, when it really will resolve on its own as you get away from the cold temperature or the stress resolves. But then there's secondary Raynaud's, which is usually associated with an underlying medical problem, and different connective tissue disorders, certain diseases of the arteries, repetitive action or vibration, smoking, okay, and certain medications too. So if you're having Raynaud's phenomenon or Raynaud's syndrome, have it checked out by your primary physician or your podiatric physician.